When placing an intravenous catheter, the first step is to gather and prepare all necessary supplies. This includes clippers with a 40 blade, tape, your injection port, desired size of catheter, gloves, alcohol, an antiseptic scrub, gauze or cotton, and then a fluid set if you will be administering fluids. So first, after you gather your supplies, you want to make sure that you loosen the packaging and have everything prepped, like the tape, the pieces of tape ready, so that you don't have to be faddling around finding your supplies when you're already into the vein. So first what you want to do is make sure that you have the correct patient, and then you will take your clippers with the 40 blade and shave an area about 2 inches long to 1 to 2 inches wide to have sufficient room to insert the catheter. So once you have shaved the leg, it is then time to prep with an antiseptic scrub. But beforehand, you want to make sure that the restrainer is holding the animal in the proximal end of the limb as you hold out the distal end of the paw out straight, so that you can have the patient in position before you start antiseptically scrubbing. So once that is in place, you will take gauze and your antiseptic scrub, and starting from the center, go in concentric circles, repeating about 3 to 4 times, and discarding the piece of gauze and getting a new one every time you hit hair. Sometimes beforehand you can take a piece of gauze with antiseptic scrub and rub vigorously up and down on the vein, and then also repeat that process with alcohol. But as long as you do concentric circles and do that at least 3 times, that step isn't always necessary, and you want to make sure that you maintain a contact time of 2 to 3 minutes for the antiseptic scrub so that it can properly do its job. So you've shaved the leg and you've antiseptically scrubbed. The patient is in position. So now it is time to actually begin placing the catheter. You're going to make sure that you want to communicate with your restrainer to occlude the vein. And taking your catheter, you're going to advance the stylet bevel side up at a 30-degree angle to the vein until you see a flash of blood in the hub. Once you see that flash of blood, you can stop advancing the stylet and feed the catheter all the way up to the hub. Then, at that point, before you attach your injection port, you're going to remove your needle and ask the restrainer to stop occluding the vein and just hold it, making sure not to hold it at the injection site because that can cause contamination. Then you're going to take your injection port and screw it onto the end of the catheter. Once that is in place, you are ready to tape and make sure your catheter stays secure to the leg. So first, taking either the fat piece of tape or a skinny piece of tape, depending on how your practice likes to tape, you will take the fat piece of tape, stick it sticky side up underneath the hub, and then wrap twice around the leg. And then you can either have a piece of tape in a V shape, stick that at the catheter, underneath the catheter at this angle for security, or take 2 skinny pieces of tape, sticky side down, place it over the hub, and then wrap it around the leg. Ultimately, it doesn't matter how you tape as long as the catheter stays secure. And throughout the whole process, you want to make sure not to be touching the aseptically scrubbed area because that will cause contamination and you'll just have to re-scrub all over again. So that is a really important step I forgot to mention in the beginning, but throughout the whole process, you want to make sure not to be touching the shaved area with your bare hands. And so once the catheter is securely placed to the leg, you want to make sure that you note the time and placement of every IV catheter in the patient's medical record.